In this video, we are going to show you proper placement of an IV catheter for chemotherapy administration. Supplies needed: clippers and diluted chlorohex scrub for proper prep of the catheter placement site, 20 or 22 gauge IV catheter, 3 cc syringe with saline for flushing the T-port before placement, and 1-inch porous tape for securing the catheter. These should all be readily available within your hospital. VOP provides the T-port with lure lock connector. The first step in IV catheter placement is to prime your T-set. Open the VOP provided T-connector, attach a 3 cc syringe with saline flush to the blue clave port, and flush the line completely. Then secure the clamp on the line. Clip and prep the area in routine fashion. We recommend clipping 360 degrees around the leg. Place a standard 20 or 22 gauge catheter. To prevent extravasation, which occurs when the drug leaks outside of the vein during administration, a clean first stick catheter should be used. If your attempt is unsuccessful, or you are not confident in your catheter placement, you should change legs and use a new vein. Once the catheter has been advanced off the stylet cap may be used as a temporary plug in the catheter to allow for securing the catheter with tape. Once the catheter is secured, the stylet cap should be removed and the pre-primed T-connector attached to your catheter, ensuring that the lure lock connection is firmly seated by twisting it in a clockwise direction. To properly secure your T-port, use a thin strip of tape to secure the T-port to the IV catheter. Finish taping. Flush your catheter by attaching your saline flush to the T-connector's blue clave. Pull back on the plunger of the syringe until blood is noted in the line, confirming proper placement of the IV catheter. Then flush the line completely and clamp the line. Apply one final piece of tape to hold the line of the T-port connector in place on the leg. Make sure to leave your blue clave and line clamp exposed to facilitate drug administration. You are now ready to administer your patient's IV chemotherapy dose.